All right, today we're diving into a real medical detective story. It kicks off in a Michigan emergency room, but where it ends? Well, it shines a pretty alarming light on one of humanity's oldest and most infamous diseases, syphilis.
And it all starts with a cluster of symptoms. Now, on their own, you might not think they're connected, but together they created this baffling and frankly terrifying puzzle for the doctors involved. So let's meet PC. Back in 2022, she walks into an ER with a condition that had just completely and rapidly taken over her life. She was the very first clue in what turned out to be a much, much bigger mystery. Now, what's really wild here is just how fast all of this happened. I mean, it started with a headache she thought was just her old shingles acting up. But then it just spiraled. In just 8 weeks, she went from a nagging pain to debilitating joint pain, seeing spots, and severe hearing loss. Her body was under siege, and nobody knew what was causing it. So you can imagine what her doctors were up against. With symptoms this widespread and this aggressive, they had to start hunting for the cause, and they had to do it systematically before things got even worse. Okay, so they started ticking things off the list. It wasn't a stroke. This whole thing unfolded over weeks, not seconds. It wasn't cancer. Her brain MRI came back totally clean. An autoimmune disease? Maybe, but her weird mix of eye and ear problems didn't really fit the textbook definition for any known disorder. And that left one major category on the table. It had to be an infection. And this really shows you the problem they were facing. Sure, a disease like lupus can cause eye and ear issues, but it just didn't fit PC's case. She was missing all the other telltale signs. Her symptoms were this unique, disturbing collection that just defied a simple diagnosis. So doctors had to keep digging for some kind of infectious agent. That narrowed the search down to 2 main culprits, both caused by these spiral-shaped bacteria called spirochetes. First up, Lyme disease. It's super common in Michigan, and yep, it can cause every single one of her symptoms. But there was another possibility, one caused by a different spirochete, syphilis. So to find out for sure, the doctors took a sample of the fluid from around her brain and spine. And the results? They were crystal clear. PC had neurosyphilis. The bacteria had actually invaded her central nervous system. So mystery solved, case closed, right? Well, not quite. This little spiral-shaped guy is the organism responsible Treponema pallidum, and in its most severe form, it can attack the brain and nerves, which totally explains PC's crazy headache, vision loss, and hearing problems. But believe it or not, the story was about to take an even more shocking turn. So, as required by law, the hospital reported the syphilis case to the state. And the Michigan Department of Health's reaction was immediate and intense. They launched a full-blown investigation. This was suddenly about a lot more than just one patient. So remember, it all started with PC, what we call the index case. Just one woman, with this unusually severe version of the disease. But the investigation quickly uncovered 4 other women, all in the same part of Michigan, all showing up at different hospitals with almost identical, severe eye and neurological symptoms. You just can't ignore a pattern like that. And here's the bombshell. When public health officials started talking to the women, they discovered every single one of them had been intimate with the same man. This wasn't just a random series of cases anymore. This was a concentrated, fast-moving outbreak. The timeline of this thing is just chilling. Over just 9 weeks, this cluster exploded across multiple counties in Southwest Michigan, and each woman was developing these serious, life-altering complications incredibly quickly. And this is the key takeaway, right? What happened to these 5 women was not normal. Getting severe ocular syphilis, that is, syphilis affecting the eyes, this quickly after an infection is supposed to be really rare, especially in patients who don't have other major risk factors like HIV. This strongly suggested something else was going on here. So the Michigan outbreak wasn't just a local public health crisis anymore. It was a huge red flag, and it pointed to a much bigger, much more fundamental question. Is the syphilis bacteria itself changing? And to get why that question is so urgent, you have to look at this. After hitting rock bottom around the year 2000, syphilis cases in the U.S. have been on a steady climb. And it's simple math. More cases mean more hosts, and more hosts mean more chances for the bacteria to mutate and evolve. And guess what? We now have direct proof that it is evolving. In this landmark 2023 case out of Seattle, scientists found a man who was infected with 2 different strains of syphilis at the same time. When they analyzed the bacteria from his body, they found a third, brand new strain, a hybrid that had basically mixed and matched DNA from the other two. This was the first time in history we have ever seen syphilis create a new version of itself inside a single person. So let's connect the dots here. We've got cases rising across the country for years. We know that other infections can make the disease worse, and these severe eye cases seem to be popping up more often. And now we have the final crucial piece of the puzzle, hard proof that the bacteria is creating entirely new strains. And that brings us right back to Michigan. Those 5 women didn't have the usual risk factors that would explain why they got so sick so fast. This points to a really chilling idea. Maybe the problem wasn't just about the patient's health. Maybe it was about the bacteria itself. They might have been infected with a new and unusually aggressive strain. You know, we used to think about how bad a case could get based on things like a person's immune system or if they had other infections. But what this shows is a brand new factor we absolutely have to consider now, the specific genetic makeup of the bacterial strain they're infected with. Which leaves us with a really unsettling question. Was that Michigan outbreak a warning shot, a sign of things to come? Are we actually witnessing the emergence of a more dangerous form of syphilis, one that can cause severe damage faster than we've ever seen before? And that leads to the final and, honestly, the most frightening thought of all. Syphilis has already become resistant to other antibiotics. If it keeps swapping genes and evolving, could it one day create a strain that's resistant to penicillin, the one drug we have left that can reliably cure it? That's the billion-dollar question that's keeping public health officials up at night.